Time was when one medical test was good for both men and women. After all, how much difference could there really be, medically speaking? Turns out when the matter is life or death over heart attacks and strokes, the difference in a simple test could truly make the difference between life and death. This is Women's Heart Health Month. So let's bring attention to something every woman needs to understand with the Assistant Professor of Medicine in the Division of Cardiology at the University of North Carolina and the author of Women and Cardiovascular Disease. Dr. Kevin Campbell joins us on the show. Dr. Campbell, thanks so much for being here.
Thanks for having me. We've got to go red for women this month for sure.
Let's do that, and let's also start out with this whole study here that talks about chest pains, stroke, heart attack, and that one test does not fit all. That would seem to be pretty logical if you think about it, but we have an awful lot of tests that are out there that are given to men and women every day that supposedly will take care of you no matter what gender you are, correct?
That's exactly right. We do know that biologically, when it comes to heart disease, that women and men are very, very different. Women present differently than men, and women don't respond to the same tests the same way that men do. This particular study showed us that if we use a more sensitive test, we can detect a heart attack in women that normally we might miss if we use the standard test.
So this was a study funded by the British Heart Foundation. Tell us a little bit about this and how they got around to basically deciding that there was going to be a difference here and that this test would be gender-specific necessary.
We know both in the U.S. and in the U.K. that women tend to be undertreated and underserved and underdiagnosed. So these researchers tried to look at ways to better diagnose women with heart disease. There's a particular protein called troponin that is released when you have a heart attack. And in the standard test, we weren't picking up as many women as we should be. So they used a different test that was more sensitive, and we found that it doubled the number of women that we picked up as being positive and allowed them to get the treatment that they deserve without being sent home from the emergency room.
Why underdiagnosed? Is that because the doctors are missing it, the medical community was missing it, or women themselves aren't paying attention to their health and their treatment?
I think it's a combination of all of those. I think one thing we need to know is that a woman's greatest health risk is not from breast cancer or uterine cancer. It's actually heart disease. It's the #1 killer of women in the U.S. and Europe today. It kills more women than men. And I think it's a matter of awareness, both from women themselves as well as the medical community. And I think we all have to redouble our efforts to make sure that women are treated the same way as men when it comes to heart disease.
So women are going to their doctor right now. What is it that they need to be knowledgeable about? What is it that they need to ask and or demand of their doctor to do in order to make sure they're getting the right tests?
Well, first of all, they need to understand their risk. If a woman has a family history of heart disease at an early age, if a woman has high blood pressure, diabetes, high cholesterol, obesity, or if she's a smoker, that puts her at elevated risk, and she needs to make sure that her doctor partners with her and evaluates her with a stress test or other tests to see if she is at risk for heart disease at that point.
But because 1 in 10 women with chest pains are diagnosed with a heart attack compared to 1 in 5 in men, doesn't this also speak to the doctors themselves and the physicians need to better understand what those trip markers are, and they need to understand a little bit more about the patient in depth?
I think that's exactly right, because we as a medical community often think of heart disease as a disease of men, when in actuality it's women too. I think that we have to redouble our efforts to educate our peers. Another thing that we see is that many women only see an OBGYN doctor rather than an internist or a family doctor, and we have to make sure that OBGYN doctors are equipped and able to pick up signs and symptoms and refer those patients to the appropriate cardiologist.
Dr. Campbell, why is it that once again, like in so many other instances, we talk about medicine, we talk about health, I keep hearing it in the back of my head, eat healthy, take care of yourself. It's still the way you have to begin everything, right?
It is absolutely. Diet and exercise are so modifiable, and if you're a patient, you want to engage with your healthcare provider. Work on these things together, and your healthcare provider can treat you with medicines for your cholesterol, your blood pressure, or your diabetes if necessary. But there is individual responsibility here as well.
Work with the doctor and also learn a little bit more. The book, by the way, we want to heartily recommend it because it'll give you an idea of what is happening in your life. It is called Women and Cardiovascular Disease. The author is Dr. Kevin Campbell. Dr. Campbell, thanks so much for joining us.
Thanks for having me today.
All right, take care. While there were no literal fumbles in the Super Bowl, there was one last year at this time that cost a living creature his life. We'll talk about that momentarily.